nursing student Jason. Today I am, hopefully if you're the right person, can I get your name and date of birth? All right, Mary Potter. All right, you related to Harry? Anyway, yeah, that's you, according to my orders, doctor's orders that say that you need me to put a feeding tube in you. So do you have any questions? Have you ever had a feeding tube before? Well, so what we're gonna do is I'm gonna sit you up, and, fairly upright. It'll make for easier placement. I'll lubricate the tube. Not now because you're a plastic person and it'll be bad for the plastic. So I'm gonna put the tube into your nose, and then it's going to, after having measured how far it has to go down to the xiphoid process, and I'll slide it down, and I'll make sure that it's in the proper place with an X-ray, and make sure that I can't hear any breathing in it, because that would be really bad if I actually put it into your trachea. So yeah, we're trying to get it into your esophagus. So and it kind of helps if while we're doing this, if I'll bring you a little bit of water so you can take small sips, and that'll help you swallow the tube so it'll go in the right spot. So anyway, and as we're doing it, I'll let you know, and when it feels, like it's down there, you're gonna want to bend your chin to your chest a little bit so that it'll go in the right spot. So, because your trachea is in the front and your esophagus is in the back, and when you bend down, it'll help it go toward the back. All right, sound good? All right, well, I'm gonna go ahead and get my hands washed, and I'll be back, and I'll get all my supplies that I need. All right, I'll see you in a little bit. All right, wash my hands, sanitize, come back, put on a pair of gloves, and thank you to whoever got this box of gloves. So put on a pair of gloves. I'm gonna go ahead and I'm gonna sit you up using my knuckle right now, so that I don't try and keep the insides clean. Although this is not a sterile procedure, but yeah, also I want to get vitals and everything to include the pulse ox, and I would go ahead and listen to lung sounds, and use my handy dandy flashlight, pen light, to find out the nares are clean, or if they're open. Can you close one of your nostrils and breathe in and out, and then the other one and breathe in and out? All right, good. All right, so it looks like I'm going to use your single nostril, and that's the one that you have. So I'm going to go ahead and get my equipment after having already done vitals, get some kind of a baseline and pulse ox. And so yeah, I'm going to go ahead and open this, and I'm going to take off my gloves, hand sanitize, put on a new set of gloves, and then doing this because they're not my gloves to just run through. And so now I'm gonna take this, and I want to measure how far down the tube I'm gonna have to go. So I'm gonna go from the tip of the nose to the earlobe, and then from the earlobe down to the xiphoid process. So really, I could put the tip of the xiphoid process, and then go to the earlobe. And it's not a sterile procedure, luckily. So right there, and then right there. You're about the 46 mark. All right, so I'm going to go ahead and put a piece of tape at the 46 mark. So that is about how far I want to insert the tube. When the tape reaches your nose, it will hopefully be in the right spot. Okay. So, if you could, I'll provide you with a little bit of drink. And I'm going to go ahead and insert this into your nostril now. All right, and it will be slightly uncomfortable. That is to be expected. After having looped this up, it would go a lot easier. Oh my goodness. All the other rooms are taken. We might have been able to find a patient that had bigger nostrils. There's a little bit of tape on this already. Maybe that'll slow me down, but that's all right. Having been fresh out of a bag, that would have not been there. I don't think this is going to go too much further. All right, so I would make sure I once I get down to I want to see if I'm past the down by the pharynx, and make sure that the tubing is not coiling at the back of the throat, and want to have the patient tilt their head forward so I can continue to push so that this gets to the tip of the nose, which it won't do because this nostril is a little too narrow, and it's not actually lubed. And so now I'm going to keep pushing and listen to see if, so I find out, oh, yeah, no air, but so we're not evidently in the trachea, and keep going. And then when it gets, so now I also want to get an x-ray to make sure that it's in the right spot. Once I get it to there, make sure that it's actually in the stomach. And then once it is, then I can go ahead and I would hook this up to whatever I need to. It could be suction, or if I'm going to be feeding them, hook it up. But also, I want to secure what I have, so I'm going to pretend like this end is hooked up, and I'm going to secure this to their nose. So I'm going to take a little bit like that, without blocking their other nostril. All right. I don't know that this is the right kind of tape we want to use. It's pretty fragile stuff, but in the hospital they don't usually use such thin tape. But so I've got that, and I'm also going to take this over here by their chin / ear, or not chin, but on their cheek. All right. And at this time, I would make sure the person is comfortable. I could find out, go ahead and get their vitals again. I'm sure there's a little, their blood pressure would be a little heightened now, having experienced all that. I want to make sure that they have good lung sounds, and let's see, I want to get them into a comfortable position, and go ahead and yeah, I think I can call it a day. I'll clean up, perform hand sanitize, and then document. All right, and we're done.